An infectious President Trump, now back at the White House after spending 4 days in the hospital with the coronavirus. He returned from Walter Reed National Military Medical Center last night wearing a mask as he walked off Marine One. He then took the mask off once he reached the White House. There on the balcony, there you see the president just stripping the mask off, even though there are photographers and staffers there with him. There are people within the residence who are there to clean it. There are still people working at the White House. Moments later, the president posted this video message on Twitter.
And one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it. We have the best medical equipment. We have the best medicines, all developed recently. And you're going to beat it. I didn't feel so good. And 2 days ago, I could have left 2 days ago. 2 days ago, I felt great, like better than I have in a long time. I said just recently, better than 20 years ago. Don't let it dominate. Don't let it take over your lives.
Michael Beschloss, who's a presidential historian, tweeted this in the wake of President Trump on that balcony. In America, our presidents have generally avoided strongman balcony scenes. That's for other countries with authoritarian regimes. Ben Tracy joining us from the White House there to discuss this, Ben. And I'm reminded of what Mr. Beschloss tweeted, Ben, because not only do you have that image of the President of the United States on the balcony, which is something generally we have not done in this country, not only do you have the President of the United States stripping off his mask as if he couldn't wait to get rid of it. I understand that, but you've got little kids that are heading back to school right now that are able to keep the mask on for the amount of time that they have to be around their teachers or have to be around other people. Not only that, you've got the president's tweet yesterday suggesting to the entire country what he suggested, which is insulting to the 210,000 people who have lost their lives, which is insulting to the people who are living with it. The president saying in that tweet, don't let it dominate your lives. Look at this place. We haven't seen, our colleagues haven't seen you, Ben, in 6 months. I know the president is his own communicator. Is anybody checking with him to see and to follow up with him to point out that these images and the things he's saying aren't just working?
Well, yeah, and then the bigger issue here is, obviously that moment was designed to portray the president having, gotten over coronavirus, which he has not. His own doctors tell us that the president is not yet out of the woods. The president is still on very strong medication, including a steroid, which our own doctors, Dr. John LaPook, has said oftentimes when they take a patient off of those steroids, they then crash because they lose all the energy that's in their body from that steroid. So the president still has a ways to go here, and so to kind of project that after 3 days I conquered this virus and it's not that big of a deal, so Americans get back out there and don't let this dominate your life, it's a curious message because the president is not out of the woods yet, per his own doctors.
Yeah, and the images certainly sort of projected that, but also in that statement he said, I don't know, maybe I'm immune. I don't know if he understands what immune means, but if you're currently battling something, you can't be also immune to it. But he is back at the White House, back at work. Please tell me there are some safety measures in place to keep the people who will be working in the White House with him, alongside him, to keep them safe. I think this morning we learned now that there were 2, I believe, housekeeping employees, people who work in the White House but not directly for the administration, that have tested positive as well. And those are people who were not necessarily in contact with the first family.
Yeah, this outbreak continues here at the White House, so the president's coming back to a White House that is still very much the center of a coronavirus outbreak. We had the press secretary, Kayleigh McEnany, announce yesterday that she has tested positive, some other aides in the White House press office as well. So that's still very much the reality here at the White House. In terms of the precautions that they're taking, they do say that there will be precautions. We've learned the president's likely going to be briefed via the telephone or by video rather than in person. We're told by the White House that appropriate PPE will be used by anyone who actually does have to come in contact with the president. And obviously he'll have, excellent medical care here at the White House. The White House Medical Unit is considered just a step down from the kind of care that he would have had at Walter Reed. There's even an intensive care unit here at the White House if his condition did take a turn for the worse. So they're telling us that those precautions, those preparations have been made. We'll see how that plays out. I can tell you the West Wing's a pretty quiet place these days. A lot of people either working from home or are now in quarantine or infected with the virus itself. So day by day, there are fewer people actually here in the building.
And yet, Ben, I want to ask you about the president's tweet with regards to the flu, but just what you pointed out there are fewer people working at the White House, but there are also dozens of people who work in the White House who are largely unseen by those of us in the public, sometimes by even those of you in the White House press corps, who are apolitical, who have served multiple presidents, who are in often, many cases, black and brown people who are, as we know, more susceptible to the coronavirus, that work every single day in that White House. There are the chefs, there are the cooks, there are the cleaners, there are the people who work the grounds. Their lives are now potentially at risk with the President of the United States back in the White House. Are you hearing at all from staffers that they are angry about the president choosing to return to the White House, even though he is still infectious, even though he is likely contagious?
There's certainly concern and frustration because people just don't know how this is going to play out here. And you mentioned a lot of the people that you just talked about, the butlers, the florists. I mean, it runs the gamut of people here. It's nearly 100 people that do support kind of the residential part of the operation here. And, we see just in our small, cramped press space here at the White House, there's people now that come in and clean about 3 times a day. These are wonderful people who are risking their own health to go in there and try to keep things as clean and as safe as possible. So that's happening all over the White House complex. So this is something they're going to have to think about because it is remarkable when you kind of look at the bigger picture here. The White House itself is now a COVID treatment ward for 2 patients, the president and the First Lady.
This is going to be a question I think might be tough for you to answer. When we learned of his positive diagnosis, we wondered whether or not it would have an impact on, the way he viewed this virus and the pandemic. And, one of the first video addresses that we saw of him in Walter Reed talked about how he had learned so much about the virus, not just book learning, right? Real learning. And he reiterated that with his video that he posted last night, that he learned so much. But then, even within that video, there was a heavy focus on treatment, not prevention. We have the best medicines here. This morning, he compared the coronavirus to the flu and threw out a couple statistics that were just completely incorrect, completely off. Talking about 100,000 people suggesting killed by the flu. But, sometimes with this imprecise language, it's very difficult to tell exactly what he's saying. But if you go to the CDC website, you can verify that. Look at all the years, the past 10 years of the flu, you'll see that nowhere close to 100,000 people each year have died because of the flu in this country. And so my question, in a roundabout way, is, do we have any indication that this experience is altering or changing the president's attitude towards this virus?
I don't think so, not based on what he has said in the last 24 to 48 hours. You mentioned that video that he posted from the hospital, which I thought was very interesting too, where he said, I've learned a lot about this. He used the phrase, I understand it. And I think there was a thought for a minute there that perhaps having experienced this firsthand, and not that it should take having to go through it himself for him to really understand it, but that perhaps he had come around to thinking of this in a more serious way. Perhaps he might have come out and said, I haven't always been so great about wearing a mask. I've kind of downplayed that, but I've learned this really would help, so I think everyone should do it. But it appears that what he learned, based on what he said last night from the balcony at the White House and then what he's tweeting this morning, is pretty much what he knew going in, or thought he knew going in, that he doesn't believe this is really that bad. He said, don't let this dominate your life. Don't be afraid. Get out there. That's not the message that his own public health experts have been putting out there for months. They've said that we need to take this seriously. It's not about necessarily being afraid, but it's about taking precautions to make sure that you don't put yourself at unnecessary risk. And then for the president to say today, this comparing it to flu again is basically going back to what he was doing this past spring. So I guess the answer to your question is just based on what he is saying alone, it doesn't appear that he has really changed his thoughts.
Yeah, I mean, Ben, as you pointed out through his tweets, the president saying, don't be afraid of COVID, don't let it dominate your lives. We've seen people who have lived with COVID, who have lost people to the coronavirus, tweeting back at the president, talking to reporters. explaining how insulting this is to them, to the memory of their loved ones, to the people who, I mean, there are companies across this country, including this one, but thousands of others that have put into place the recommended guidelines by the CDC. In other words, we can't be with our colleagues. We can't go to the funerals of our loved ones if they succumb to this virus. We are probably not going to be able to enjoy Thanksgiving the way we have been able to in the past. Kids are not going to be able to trick or treat. There's a whole slew of things that people have to do to protect themselves and those that are most vulnerable among us from catching this infectious disease. The president and now his campaign seem to be saying, well, look, this is going to happen. And the fact that the president became infected with COVID-19 is how a leader leads. I just don't understand how that works, given, as you pointed out, that Kayleigh McEnany, the press secretary, has tested positive. And now 3 White House journalists have also tested positive for the virus. There are concerns in the White House about the protocols that are in place in the White House that don't seem to be the same protocols that the grocery store across the street has in place for their employees and their patrons, for those of you who are working every single day at the White House.
Yeah, I mean, if you want to walk into a Trader Joe's right now without a mask, you're not allowed to do it. But there are plenty of employees here at the White House staff, who are walking into the building without a mask on, and that's considered a personal choice. And that's been the way that it has been here for months. There's been very little mask wearing. There's been very little social distancing. We've all now seen the pictures of that Rose Garden event where the president nominated his Supreme Court justice, where people were sitting shoulder to shoulder without masks on. And the feeling here was, well, it's outside and a lot of these people have been tested. And there has been this over-reliance on testing here, as if testing is some sort of precaution or some sort of prevention in terms of getting the disease. The test just lets you know whether or not you have it on that given day in that given moment. It doesn't mean that it's protecting you from actually getting the virus. The other thing I think we should mention is, when it comes to the president's thoughts on this, he received medical care that the average American is not going to get if they get infected with the virus. He got to go to a top-notch hospital, an entire wing of a hospital that's designed just for him. He was given 2 very strong experimental drug therapies that a lot of people simply don't have access to. So his experience with this is different than what a lot of Americans would and have gone through if they get the virus themselves.
Yeah, Ben, and it's important to point out too. Yeah, a lot of people had to get tested to get into the White House. You do, but there are many, many questions about just how frequently the president himself was tested, and we still don't know when his first positive test occurred.
Yeah,
but
Anne-Marie, can I just ask about
day.
that? No, I know we have to run, but Ben, it's an important point there.
You can ask, but the director's going to kill you.
I know, but it's an important point because Ben,
right.
the president in the White House refuses to tell us, the American people, when he was tested. But just remind our viewers, what were they saying about the frequency of the president's tests? And did they have to be tested before they participated in the first presidential debate?
Yeah, so the president has told us that he gets tested at least once a day. For the debate itself, the agreement going into the debate was that you would show up with enough time to get tested before the debate began. They say the president arrived too late and was not able to get tested, but because he had been tested at the White House that morning, there was kind of a gentleman's agreement that they took his word for it, that he had tested negative. So that's where that stands on the debate.
All right, Ben, thank you so much.
Thanks, Ben.
Thank you.